Hey, good morning. I'm Marty Marin, and this is my wife, Michelle, and we manage Trio Maryland. And we'd like to welcome all of our members and guests this morning. Today's topic is really special. It's on strategies for a safer living after transplantation. At our next meeting will be on March the 12th, and we will have the National Kidney Foundation with us. Patty Dash is the executive director, and she'll be here along with a special guest speaker. And before we get started, let me remind you to check out our events page on our website. You'll see a lot of our advanced meetings that we're going to have later on this summer. There's a lot of great topics, so you may want to go on and reserve the spot on your calendar. And now I'm going to turn the meeting over to Michelle, and she'll introduce Dr. Seema for us.
Hi, good morning. So today we're really happy. Today's guest speaker is Dr. Seema Steinke. She's a clinical assistant professor of medicine at the University of Pittsburgh Medical Center. She's also part of Infectious Disease Connect Incorporated. Dr. Seema is really a special friend to Trio Maryland. She has presented in person for us many times over the years and has been in our conferences, and she's awesome. We love her to death, and we're very happy that she can join us here today and present to our group. So thank you, Dr. Seema. Welcome, and I'll turn the program over to you.
Thank you. I'm happy to be here. So as mentioned, the topic for today is strategies for safer living after transplantation. The objectives for today's talk are to understand what infectious risks exist after transplant, identify measures that can be taken to prevent infectious risks, and to recall the COVID-19 guidance for safer living. Infections remain a risk to solid organ transplant recipients long after the initial post-transplant period. What factors affect one's risk? So your net state of immune suppression, which I will touch upon briefly in just a minute, your exposures, and the consequences of invasive procedures that you may have undergone. And where do these infections come from? So some infections can be due to organisms within the body. So for example, things that we considered endogenous organisms as the medical term for them. Things that we consider infections like viral infections, like CMV or cytomegalovirus is something that is considered an organism that can be within the body that can cause an infection. It can be due to donor-derived infections or infections that you acquire from the donated organ, or it can be due to environmental exposures. In this talk, we're going to focus primarily on those due to environmental exposures. So it's essentially a balancing act. The major goal of transplantation is to be able to lead as healthy of a life as normal and possible. The risk of exposure to infectious agents will always be present throughout your lifetime. And you should be counseled by your care team on ways to minimize the risk of infection. Strategies for safe living must be incorporated into the transplant recipient's life as they move forward, regaining normal function and returning to an active and productive life. So the balance is really between the quality of life and the survival of your donated organ. So what is your net state of immune suppression? So as you can see here in this graph, you have a normal immune system function, which is functioning at, let's say, 100%. And it's just going on doing its job. And that's in someone who is otherwise completely healthy, without any medical issues, and without any medicines on board that help suppress the immune system. Whereas if you are a transplant recipient, if you receive immunosuppression, for example, in your first month after transplant or immediately after you get your organ, your immune suppression, or your immune system rather, is functioning perhaps at around 20%. And it does so for approximately the first 6 to 12 months after transplant. Then it kind of goes up a little bit and maybe functions at around 35% or so, and then maybe further improves and is functioning at about 50% as time goes on, because the initial effects of the aggressive immune suppression that you got at the outside of your transplant have kind of worn off a little bit, and you're on what's now called maintenance immune suppression, where you take your anti-rejection pills and they are doing their job at keeping things quiescent and at bay and no major hiccups along the way. But then all of a sudden, something happens and say you get sick and your immune system is a little weaker because of the illness that you get, and that can lead to a bout of rejection. And then once again, because you're in rejection, your physicians will give you medicines to aggressively suppress your immune system, and you may head back down to where you were at the time of your initial transplant, back functioning at around 20%. And so this may continue again for another 6 to 12 months. And throughout this time period, you are at risk for infections because, as you can see, your immune system is not functioning at the normal 100%, but your net state of immune suppression really refers to where you are along this graph. So oftentimes people can remain at this 50 or 60% time point of being immune suppressed for years before having a bout of rejection, or even just for years on end without having rejection and without going back down to this. But this tells us that you are still immune suppressed, but how immunosuppressed are you? And that's what we think about as physicians, is what is their net state of immune suppression right now? And that tells us what infectious issues you may be at risk for. So moving on to what are some of the environmental exposures that we think about as physicians. So we look at occupational exposures, recreational exposures, exposures you may have while traveling, the people you come in contact with, the animals you come in contact with, and the water that you may be drinking or exposed to on a regular basis. And as time goes on, it's really easy to become relaxed. So even though we consider that net state of immune suppression, as I just mentioned, we still also think about the fact that you may be 20, 30, 40 months out from transplant, and you are likely to become a little bit relaxed in how protective you are of yourself. And as a result, you may be at risk for more things than the average person would be if they had been more protective or more cautious if they had had a bout of rejection, for example, or something, and we're a little bit more cautious as a result of that. So it's really easy to become relaxed, and we do take that into account, and we do recognize that because, of course, you have to go on living your life, and we don't want to prevent that from being the case. So how do we assess the risks? So it's really important that we understand the risks that you are being exposed to. So we'll end up asking a lot of questions like, where do you live? Where were you born? Have you had any travel, recent or remote? What are your pet or animal or bird contact exposures? What's your occupation, your hobbies, your lifestyle habits? Are you exposed to anybody sick? And what is your water exposure? So as physicians, we'll ask you tons of questions to understand why you may be sick if you present to us ill, or sometimes these questions are asked preemptively in a manner to educate you on how you can take preventative measures to protect yourself. So when we talk about where do you live, where were you born, and where have you traveled, we do so because different parts of the world have different infectious risks. So different areas, for example, may have a higher chance of being exposed to tuberculosis. It's not as common in the US, but if you were to travel to parts of Asia or South America or Africa, then the risk of being exposed to something like tuberculosis is much higher. So really, getting that information from you, we're not trying to be frustrating or annoying by asking you every little detail about every trip you've taken, but we're doing so that we can understand what things you may have been exposed to in your lifetime, because some of these infections also remain dormant in your body after you've been exposed and can wake up during times of intensified immune suppression, such as during the initial months after the transplant or during a bout of rejection. And so it's really important that we know what these risks are. So once we've talked about where you live, where you were born, and your travel, we often will talk about what animals you've been exposed to. So just a couple true and false questions. So dogs are safer than cats when it comes to infection transmission. So this is true, but to an extent. Dogs and cats can both transmit infection, but dogs do so just a little bit less than cats. So they both have infectious risks associated with them, but cats are a little bit more risky than dogs. Sorry if you're a cat lover, but I'm not saying not to get a cat. I'm just letting you know so that you can be aware of these things. It's okay to pet stray animals. This is false. Stray animals are riddled with all kinds of infections and illnesses and diseases, and it's really important that you protect yourself. So if you see a stray dog or cat, it's really important that you take protective measures for yourself, and it's better to call animal control or some other authority to try and help assist with handling that stray animal if it needs assistance. And then reptiles like snakes, iguanas, lizards, they do not transmit any infections. This is also false. There's quite a few infections that reptiles actually do transmit, and it's really important to know this. If your children may have pet iguanas or lizards or what have you, it's really important that you're aware, because you could be at risk for developing an infection as a consequence of being exposed to these animals. So what are some animal-related infections that as infectious disease physicians we think about? So cat scratches can actually lead to something called cat scratch disease, which is caused by a bacteria called Bartonella. Cat litter can cause a parasitic infection called Toxoplasmosis. Reptiles can have salmonella. Monkeys can carry a form of the herpes virus. Chickens can have fungal infections, specifically histoplasmosis and Cryptococcus, both of which can be very detrimental and potentially fatal to a transplant recipient. Birds can have a bacterial infection called Chlamydophila, which can lead to a respiratory illness in transplant recipients. Aquariums can contain a bacteria called Mycobacterium marinum, which can lead to severe skin and soft tissue infections if you were to get cut while cleaning the tank. Mosquitoes carry West Nile virus, Zika, chikungunya, and dengue, so all viruses that can be potentially dangerous and fatal in transplant recipients. Rodents have a virus called lymphocytic choriomeningitis virus, which can cause a very debilitating meningitis. And puppies, kittens, and chicks can all carry a bacterial infection called Campylobacter, which can lead to a very severe diarrheal illness. So what are some key points when it comes to pets and animals? So don't get a new pet in the first year of transplant or during times of increased immune suppression. So in the first year after your transplant and during times of rejection, when you have increased your immune suppression to try and address the rejection. Avoid any sick animals. So if some animal has diarrhea, for example, you don't want to be petting it or being exposed to its oral secretions or its feces or anything like that. You should avoid kitty litter, cleaning bird cages, bird feeders, and handling animal feces in general. If you have to, it's important that you use disposable gloves and a surgical mask while doing so. Avoid live vaccines in animals when effective non-live vaccines exist. And an example of this would be the kennel cough vaccine. So the kennel cough is a respiratory illness that is present in animals if they were to acquire a particular bacteria called Bordetella. Now, the vaccine is a live vaccine that they often give to animals. And when they give that vaccine to animals, they are effectively inducing a mild illness in that animal, and that animal can then shed that bacteria in their respiratory secretions and can be transmitted to transplant recipients. There are several case reports of this happening. There are effective non-live vaccine versions for kennel cough, and so it's very important that you opt for that. So if you have a pet of any sort that requires a kennel cough vaccine, it's really important that you work with your veterinary doctor to let them know that you're a transplant recipient and tell them that you can't have your animal receive live vaccines, and they will work with you to provide the non-live vaccines when available. And when it's not available, it's important that if you have to give the live vaccine to your animal, that you avoid the animal's secretions and stool and urine for approximately 2 to 4 weeks afterwards. So it's really important that you just know this, because as I said, there's lots of case reports of vaccine related illnesses being transmitted to transplant recipients. You should take your pet regularly to the vet for checkups. You should avoid stray animals, as mentioned earlier, and avoid contact with non-human primates or monkeys. Ensure that areas near the home are free of raccoon latrines. So if you notice a family of raccoons kind of hanging out around your home, it's important to call animal control to have that cleared away, because that can be a huge risk for developing a lot of infections, including things like rabies. You should wear gloves to clean aquariums or have someone else just do this. Seek care if an animal bite or scratch occurs, and that care should be sought rather quickly because infections can set in rather quickly, and that those infections can oftentimes spread very rapidly throughout your body. So it's really important that if you get an animal bite or scratch, you clean it out and seek medical attention right away. And then wash hands after handling pets at any time, even if it's just to pet them or to cuddle with them. You should be sure to wash your hands after doing so. And then avoid mosquito bites if possible. So use products with DEET in it. I know it's not the safest chemical out there, but it is the best protecting agent to prevent mosquito bites. And as a transplant recipient, you want the best available agent out there, because mosquito bites can also lead to very harmful infections in transplant recipients. And ultimately, when it comes down to it, hand hygiene and maintaining pet health are essentially vital to maintaining your health if you have pets at home. So all of this is not to scare you away from having a pet. Pets are certainly okay to have. And despite the risk of infection from animals, there are so many benefits to owning a pet. And it's been demonstrated that transplant recipients have often had family pets without transmission of infection. So as long as you take the necessary precautions, you can certainly safely have a pet. The psychological benefits of pet ownership must be weighed against the potential risks for transmission of infection. So it is absolutely important that we do take that into consideration, but it's also important for you to remember that pets can still have infections, and you need to take measures to prevent yourself from getting sick. There's one study that's been done of 89 lung transplant recipients, which included 52% who were pet owners, and they reported a significant increase in various metrics measuring life satisfaction without any increased risk of hospitalization. And 96% of these pets were obtained pre-transplant, and 91% of these pets were indoor pets. So that's also something to keep in mind, is that these pets were not acquired after their transplant, and they were not outdoor pets, which outdoor pets can carry more infectious risks than those that remain indoors. What if you work with animals? So those who work with animals should, if possible, avoid working during periods of intensified immune suppression. Again, that initial year after transplant, and then anytime you have bouts of rejection that require intensified immune suppression therapies to try and treat that rejection. So when returning to work, those transplant recipients should minimize their exposure to potential infections by using proper precautions, including frequent hand hygiene and the use of gloves and masks when indicated. So it'll be really important for a transplant recipient, for example, who may be a vet, to avoid taking care of animals that may come in with kennel cough, for example. It's really important that if an animal comes in with a respiratory illness, that you either avoid having to care for that animal and have a colleague do it, or if that's not an option, then you wear a mask and gloves, and you ensure that you perform hand hygiene afterwards to try and protect yourself as much as possible. Now, I think that's enough about animals. Let's move on to your occupation. So we talked a little bit about what if you're a vet, but what about other occupations? So there's some pre-transplant occupations of transplant recipients that I've encountered. I've seen a professional horticulturist, an infectious disease, a general surgery or an ICU doctor, a dentist, an ICU nurse, criminal justice system worker, plant pathology laboratory worker, a farmer, gardener, landscaper, construction worker, childcare, teacher, special education provider, and pet store employee. So here are some important questions. What kinds of activities does your job involve? Are you concerned about the risk of infections in your workplace? And if so, are there job modifications that could be made to make that safer? And do your supervisor and coworkers know about you having had a transplant? Are they understanding and supportive? So what are some ways to make your workplace safer? You can avoid tuberculosis exposures by avoiding places like shelters, jails, nursing homes, immigration offices, places where we know tuberculosis tends to be at a much higher risk. You should wear gloves when handling any soil or dirt. You should wear masks or respirators when fungal spores may be aerosolized. So for example, if you're around an area with a lot of dust, or you're laying mulch or putting down dirt, all those instances, you should be wearing a mask or a respirator. If there's home renovation projects going on, it's prudent for transplant recipients to avoid exposures, particularly early after transplant or rejection treatment. Or if you're a lung transplant recipient, then it's prudent that you avoid being exposed to home renovations altogether at any time after your lung transplant. You should avoid exposure to animal feces, including bird feces. So if you do have chickens, it's best you avoid the chicken coops or cleaning the coops. And in general, meticulous hand hygiene should be performed in all situations, even if gloves have been worn. And you should wear a mask or respirator if exposures to the above is unavoidable. So if you do happen to have to clean that chicken coop, wear gloves and a respirator. That'll help prevent you from acquiring a lot of different fungal infections that can be present in chicken feces. And use common sense. If it feels unsafe or you think it may be unsafe, chances are it probably is. And so if that's the case, either avoid doing the activity or task, or use gloves and a mask or respirator, and then perform hand hygiene once the activity is done. So what about those who work in healthcare? So if you work in healthcare, you should avoid urgent care, general pediatrics, or the ER if possible. And if you can't avoid those, if you happen to be an ER physician, let's say, you should use a mask or frequently, or I would say at most or all times, just because you don't know what's going to come through the doors of your ER. You should update all indicated and allowable vaccines, and you should observe precautions whenever it's indicated to do so. And if you encounter a CMV or VZV, or in other words, CMV or a patient with shingles or chickenpox, and you happen to know that you are CMV or VZV negative, then you should avoid contact with those patients and follow special instructions, and potentially have colleagues be involved in those patients' care, because it's really important that you don't acquire those infections if you happen to be negative, as they can be very severe and serious. So moving on from occupation, what about hobbies that people have? How does that play into what risks you may be exposed to? So gardening or laying mulch, you're at risk for things like aspergillus, which is black mold, or fungal infections. You should use gloves and a mask, and you should avoid being in the garden barefoot, as there are parasitic infections that can enter through your skin and cause infection. So it's important that you're fully clothed with long sleeves, long pants, and with shoes, which I understand can be uncomfortable in the summer, but it's worth being uncomfortable than to have a serious infection develop. If you're involved with carpentry, you're also at risk for fungal infections, as well as a fungal infection called histoplasmosis. In those instances, you should be using a mask or a respirator, such as a KN95 or an N95 mask. If you are into hunting, you could be exposed to parasitic infections, including trichinosis and cryptosporidium. So you should avoid doing the field dressing. You should cook the meat thoroughly if you're going to eat the meat, and under no circumstances do not drink the water. So always bring bottled water with you. Don't drink any natural occurring water, streams, lakes, ponds, etc. It's riddled with infectious agents that can certainly put you at risk for serious illness. If you enjoy fishing or scuba diving, you could be at risk for different bacterial infections, something called mycobacterium, another bacteria called Vibrio, or parasitic infection called Cryptosporidium. So again, don't drink the water, and if possible, avoid injury while being exposed to that water. If you happen to get injured while being exposed to that water, it's important to find a treated water source and clean out the injury with the treated water immediately, and then seek medical attention as soon as you possibly can. And if you enjoy spelunking, you are also at risk for fungal infections called Cryptococcus and histoplasmosis. And if you are doing that, you need to wear a mask and gloves. And contact sports, if you enjoy football or even things like soccer, it's really important that you avoid injury to the graft or organ that was placed. So this is particularly important for kidney transplant recipients, as the kidney is often placed in areas of the abdomen that can be easily injured if playing contact sports. So it's really important that you take those precautions if you enjoy playing sports. And after any of these activities, your hands should be washed even if gloves were worn. So it's really important that hand hygiene is something that you perform regardless of whether or not you're wearing gloves. So what about lifestyle habits? So recreational drug use, marijuana is something that is becoming more and more commonly used. But we do say that smoking or vaporization of marijuana can certainly lead to respiratory fungal infections. So if you're going to use marijuana, consuming it by eating it is preferred to smoking. Other drugs like LSD, meth, cocaine, heroin, they can often be laced with unknown substances. And then if you get prescription narcotics, there can oftentimes be drug-drug interactions between those narcotics and the medicines that you may be taking to protect your organ. And as a result, you could have serious interactions develop with bad consequences. What about food safety? So you should avoid unpasteurized products, including juices, dairy products, cider, cheeses. And cheeses that are pretty notorious for being potentially unpasteurized are things like brie, feta, blue cheese, goat cheese, pretty much any moldy cheese. So it's important you check the labeling. If it says it's pasteurized, then it's safer. If it does not indicate or it says it's unpasteurized, you should avoid eating it. These products can carry things like E. coli, salmonella, listeria, cryptosporidium, yersinia, and brucella. Avoid raw or undercooked eggs. So undercooked cake or cookie batter is something to avoid eating. Some preparations of Caesar salad dressing, mayonnaise, and hollandaise sauce are all things that you should avoid eating because of the potential for having raw or undercooked eggs in them. And this can lead to salmonella infection. Avoid raw or undercooked meat, poultry, or fish, as this can contain bacterial and parasitic infections like tapeworms. Avoid raw and undercooked seafood, as there's bacterial, viral, and parasitic infections that can be involved with that. Avoid ingesting raw seed sprouts, so like alfalfa sprouts or mung bean sprouts. Sprouts in general can be riddled with all kinds of infectious agents, including salmonella and listeria. So it's really important that you avoid eating those sprouts altogether. Even if they're washed, as it's very difficult to wash sprouts so effectively. So it should be best to just avoid them. Avoid cross-contamination during food preparation. In other words, if you're cutting raw meat on a cutting board, don't use the same cutting board without washing it to then cut vegetables or something that you may not be cooking necessarily, because then you can lead to salmonella being transmitted from the raw or undercooked meat to then the vegetables. So it's best to either wash the cutting board in between or use a new cutting board altogether. And same with the kitchen counters. After handling raw meat, you should wipe down the kitchen counters before then going on to prepare whatever it is that you're going to next prepare. Avoid uncooked pate, meat spreads, cold cuts, and smoked seafood. And wash all fruits and vegetables, even if it claims to be pre-washed. Avoid eating at public salad bars, buffets, street vendors, picnics where food has been sitting out at room temperature for unknown amounts of time, and potluck meals where hygiene standards of all participants are not necessarily known. Avoid eating food prepared by someone with a recent diarrheal illness as well. Moving on from food and onto safer sexual practices. So you should use latex condoms outside of monogamous relationships, and you should use latex condoms during sexual activity, even with long-term partners during periods of intensified immune suppression. So in that first year post-transplant and anytime you were treated for rejection, you should use condoms. You should avoid exposure to feces, and you should be vaccinated against things like hepatitis B and HPV if it was appropriate to do so. And the goal is to reduce sexually transmitted infections, including hepatitis B, hepatitis C, HIV, CMV, HPV, and herpes. So what about tattoos and body piercings? So these represent a break in the skin, which can lead to infection. So these are essentially not encouraged activities, but if body piercings or tattoos are to be obtained post-transplant, then seeking reputable centers with good sterile techniques should be done. Self-piercing or tattooing or sharing of needles should be avoided altogether. And so let's move on now to water exposure. So waterborne infections most often occur due to consumption of contaminated water or inadvertent water ingestion during recreational activities. For example, if you're swimming in a lake or pond or even in a pool. Cryptosporidium is a parasitic infection that can cause severe and chronic diarrheal disease in a transplant recipient. And Cryptosporidium can be resistant to chlorine, so pools are not immune to having Cryptosporidium in them. Despite being heavily chlorinated, they can still have Cryptosporidium present. And they can rarely be found in treated water sources such as our city water supply. To eliminate all risk of being exposed to Cryptosporidium, you should bring water to a rolling boil for at least 1 minute, or if you're at elevations above 6,500 for at least 3 minutes, or utilize personal filters or consume bottled water. So if you are in a place where you're unsure of whether or not the water has been treated, it's better to boil the water, use personal use filters, or consume bottled water. And keep in mind that ice and fountain beverages may be made from untreated water. And this is particularly true if you're traveling abroad. So it's really important to keep that in mind. So don't think that if you get a cola with ice that you will be protected against any infections. You may still acquire infections that can be present in the water. So what about water filters and bottled water? So water filters should have an absolute pore size of less than 1 micron, or should be tested and certified to NSF or ANSI standard 053. NSF has a website that you can go to that discusses different water filters and things of that nature. And I've provided the link here on this slide, or you can call them and discuss water filters and other things related to water safety. And they're a really good resource for doing so. If you need more information about bottled water, you can obtain that from the International Bottled Water Association, either at this phone number or at their website. The link has been provided. And the CDC also has information devoted to bottled water technologies as it relates particularly to cryptosporosis risks. And I've again provided that website here. So all of these are great resources to learn more about water filters and bottled water. So what are some pearls of wisdom that I can share with you with regards to water exposure? So public or private well water, especially in areas that are not screened frequently for bacteria, should be avoided if possible. If used, the water should be tested yearly for microbial contamination. It's ultimately safer to boil well water or use bottled water for drinking and brushing your teeth. Do not drink directly from lakes, rivers, streams, ponds, etc. Avoid swimming in water that is likely to be contaminated with human or animal waste. So this is particularly important if you're out camping, for example, and there's a great water area nearby, such as a lake, and you want to go swimming in it. Keep in mind that it can certainly be contaminated with animal waste. And as a result, you can be at risk for serious infections, things like listeria, things like leptospirosis, many infections that can be transmitted in particularly animal waste. And so it will be very important that you avoid swimming in that type of water. Avoid swallowing water during any swimming activities, regardless of what you're swimming in. And to avoid spread of infection to others, If you develop a diarrheal illness, you should avoid using public recreational water facilities until 2 weeks after your symptoms have completely gone away. Hot tubs should be avoided, as hot tubs can actually carry different infections that are not killed by the heat of the water or the chlorine of the water. So it's important to avoid hot tubs. And standing water in the home or basement, for example, if you have an episode of flooding, should be promptly cleaned to avoid growth of mold. And this should not be done by the transplant recipient. If it's unavoidable and you have to do it as you're the only one available to do it, then use gloves and a mask during the cleaning. And when traveling to countries with poor sanitation, one should avoid drinking tap water and inadvertently consuming ice cubes or water while brushing teeth or showering. So if you're traveling to other countries, again, avoid drinking the tap water. And if you are brushing your teeth, use bottled water and don't drink any drinks with ice in it. And then while showering, just make sure you don't open your mouth while facing the stream of water. And if an abrasion or cut occurs while bathing in the ocean or fresh water, it should be immediately and thoroughly cleaned with an uncontaminated water source, so with a treated water source, and then you should seek medical attention. All right, moving on to the last section, which is going to focus primarily on sick contacts, and this is where we'll discuss respiratory illnesses, diarrheal illnesses, and COVID. So sick contacts, you should avoid them if possible. And the way to do so is to avoid crowded areas, avoid those who are sick, and avoid tobacco smoke. Firsthand tobacco smoke can impair what we call respiratory cilia, or basically the fibers in our lungs that are responsible for clearing bacteria out and viruses out from our lungs. And so if you impair that function with tobacco smoke, you are at more risk of developing respiratory infections. And secondhand smoke can also do a similar thing. And so it's very important that you avoid tobacco smoke, as it definitely impairs your ability to prevent a respiratory infection. You should wear a mask and you should perform hand hygiene. So what about diarrheal illnesses? So cleaning and disinfecting surfaces in the home is important. Some causes of diarrheal illnesses, such as C. difficile and norovirus, are resistant to commonly used cleaning and disinfecting products. So in these instances, bleach needs to be used. So if you're not sure what the cause of the diarrheal illness is, it's best to use bleach-based products to be cleaning, especially surfaces in the bathroom and the kitchen, as that will be a better option at covering a wider array of bacteria and viruses that can cause diarrheal illnesses. If someone in the home has a diarrheal illness, whether it's the transplant recipient or a household contact, rubber or disposable gloves, and again, a bleach-based cleaner should be used on environmental surfaces, as I mentioned, especially in the bathroom and the kitchen. And the CDC website includes a video on how to clean up after vomiting and diarrhea from a person with norovirus infection, which I think is actually a very beneficial video to watch. And norovirus infection, if acquired from a transplant recipient, that transplant recipient can then develop a chronic, prolonged course of diarrhea, which can be very, very debilitating. So it's very important that if you have been exposed to norovirus or someone in the household has norovirus, you should watch this video and learn how to clean up after that person, and make sure that you're using those techniques to try and minimize the amount of norovirus in your environment to protect yourself from getting it. So let's move on from diarrhea and onto flu and other vaccine preventable illnesses. So close contact of transplant recipients can transmit infections that can be particularly harmful to the transplant recipient. Vaccination against flu and other diseases like MMR, varicella, Tdap is encouraged for everyone in contact with, but particularly for those involved in the care of transplant recipients. All household contacts should be instructed on good hygiene, like hand washing, cough and sneezing etiquette, and covering open wounds. And those household contacts should also receive their yearly flu vaccine, ensure that all other standard immunizations are up to date. Contacts at work and school should also be encouraged to receive their vaccinations. So what about COVID-19? As per the American Society of Transplantation, they recommend you stay at home as much as possible and stay connected with others virtually. Avoid unnecessary travel. Wash hands frequently, so with soap and water for at least 20 seconds, or use hand sanitizer with at least 60% alcohol content, and avoid touching your face. And ensure household contacts avoid high-risk situations and receive all standard vaccinations, including the flu vaccine. So this is all recommended regardless of your vaccination status for COVID-19. If you must leave your house, maintain social distancing and limit physical contact with others, wear a mask when going outdoors, avoid crowds, avoid public transportation as much as possible, gather outdoors instead of indoors, and be sure that you follow these measures to protect yourself as much as possible from acquiring not just COVID-19, but especially during the winter time, other respiratory illnesses that can be severe. So let's move on to talk a little bit about vaccination for COVID-19 and transplant recipients. So vaccines are critical to containing further spread of the pandemic. What we know so far about COVID-19 vaccines and transplant recipients is that antibody responses to COVID-19 vaccines and transplant recipients are lower compared to that of the general population. The level of antibody that is deemed protective is yet to be defined. So we don't know what that magical number is that you need to have after receiving a vaccine to be fully protective. But we do know that there is an inverse relationship between the level of antibody and symptomatic disease. So in other words, the more antibody you have, the less severe disease you will have, and vice versa if you were to acquire COVID. The benefit from vaccination outweighs the risks for most patients. So what about a third vaccine dose? So a third dose is given at least 28 days after the second dose or the first dose of J&J. 3 doses of an mRNA vaccine is associated with improved rates of antibody production as compared to the 2-dose series. So the mRNA vaccines are referring particularly to the Pfizer vaccine and the Moderna vaccine. For those who received a single dose of an adenovirus vector vaccine or the Johnson & Johnson vaccine, a second vaccine dose with the same or an mRNA vaccine is indicated, but it is unclear if a specific vaccine is preferred for this additional dose. There is early data from the UK that suggests an mRNA vaccine is preferred to the J&J or an adenovirus vector vaccine, but this was done in healthy people, not transplant recipients. So this information is being extrapolated to those people who have compromised immune systems. Additional doses of the vaccine are safe and reasonably well tolerated with no evidence of an increased risk of rejection due to the vaccine. So what about booster doses? Transplant recipients who get 3 doses are also eligible for their booster dose. In other words, a 4th dose, 6 months later. So keep in mind that your booster dose is different than the 3rd dose. The 3rd dose is considered to be now just a standard part of the series that transplant recipients should get. A booster dose or anything beyond the 3rd dose is considered to be augmenting or boosting the antibody response that you've already had to the first 3 doses. But keep in mind, there's no data on the efficacy of booster doses in transplant recipients yet, but that does not mean that it's not being recommended. Most transplant centers now are also recommending to their transplant recipients that they receive a 4th dose or a booster dose after their 3rd dose of the vaccine from earlier this year or last year. Keep in mind that despite these doses of the vaccine, breakthrough infections occur at greater rates and with greater severity than the general population. So there have been some reports of cases requiring hospitalization and mechanical ventilation in transplant recipients in particular who have been vaccinated and boosted. But that does not mean that you should not get vaccinated and boosted. It is likely that many of these people who required hospitalization and mechanical ventilation may have still had a much severe course, even more severe than what has been described if they weren't vaccinated. It is quite possible that even the smaller amount of antibody production that they had was protective in some way. And so it's still very important that you get vaccinated and boosted. So Again, it's strongly recommended that all children and adult transplant candidates and recipients be vaccinated with the COVID-19 vaccine unless it's contraindicated. So if you have an allergy to the vaccine or any of its components. Whenever possible, vaccination should occur prior to transplantation, and you should complete the series a minimum of 2 weeks prior to transplant. It is advised that for those who receive 2 doses of AstraZeneca, that they should receive a 3rd dose of an mRNA vaccine. Antibody testing is not required prior to or after additional vaccine doses and is actually not currently recommended by the FDA. And that's largely because, as I mentioned earlier, we simply do not know what that magical number is that we need to achieve to be protective. But what we do know is these additional boosters and doses are beneficial to some extent in helping you prevent getting a severe infection. Excuse me. So it is strongly recommended that living donors be vaccinated with 2 doses or 1 dose of J&J plus a booster. All eligible household and close contacts of the transplant recipients should be vaccinated to minimize risk. And you should continue to adhere to protective measures, including masking, social distancing, and hand hygiene, regardless of vaccination status. SOT recipients who get COVID-19 may shed greater amounts of virus for longer durations as compared to non-transplant recipients. Therefore, a longer duration of isolation and/or testing may be needed to document viral clearance to help protect others from getting it. Sorry about that. If vaccinated after transplantation, then we wait at least 1 month from the time of transplantation and at least 3 months if certain therapies were used at the time of transplantation to administer the vaccine. In Canada, it is advised that we wait 1 month after transplantation, regardless of the medications received. If transplanted between vaccine doses, then we wait at least 1 month from the time of transplantation and at least 3 months if certain therapies were used at the time of transplantation to administer the vaccine. Again, in Canada, they recommend waiting greater than 1 month before giving the 2nd dose. If you've had a close contact with an individual with COVID infection, you are eligible for prophylactic monoclonal antibody treatment. So currently, these agents listed, casirivimab and bamlanivimab, are currently not being used in areas where the circulating strain is Omicron because of lack of efficacy. Sotrovimab is what is currently being used, but it is in limited supply. You should contact your transplant team if an exposure occurs. Thank you so much. I'm going to stop sharing and take questions.
Questions, please raise your hand.
Thank you, Dr. Seema. That's a lot of information. I'm almost afraid to go out of the house now. No, I'm kidding. You know, it's funny. I remember you presented some of this information years ago, and it seems so scary at the beginning when you hear all of the potential things that could happen. But if you take some of the precautions and just use common sense, like you said, I think most of us fare fairly well. So let's look at some of the questions. A lot of good mornings and good morning, congratulations. Someone donated a kidney. Someone else, guinea pigs and chinchillas that have been bred in domesticity for many generations do not carry the same diseases as undomesticated rodents. I guess, would you agree with that?
Yes, I would agree with that.
Okay. And then some Bordetella is in the same family as whooping cough. My veterinarian and kidney and liver transplant doctors at Hopkins told me my cats, which are indoor only and male and have been with me for more than 5 years, have near zero chance of carrying toxoplasmosis. They also said that the toxoplasmosis risk is for female cats that are outdoors, and they were wondering, why is their advice different from yours? And are there some subtleties there that you could share with us?
So there are some subtleties. So outdoor cats are at greater risk for having toxoplasmosis than indoor cats. That is absolutely correct. The difference between male and female is less so of an issue. There is still a risk with male cats for having toxoplasmosis. So it's not entirely a near zero chance. Being an infectious disease doctor, I think I've seen a lot of toxoplasmosis cases as a result of even having indoor cats, regardless of gender. And so I would say the chances are not near zero. They're still quite prevalent. And as a result, you should still avoid handling the kitty litter, even if you have fully indoor cats, regardless of gender. So I think it depends on who you speak to and perhaps what their background is in terms of medicine. But as an infectious disease doctor, I can say that there are still risks present. And so it's still important that if you can avoid the kitty litter, but if you can't avoid handling it, then again, use gloves and a mask and use hand hygiene afterwards.
A comment that Dario has heard that lemon oil is effective to preventing mosquito bites.
So yes, there are non-DEET ways of preventing mosquito bites, but studies have shown that they're not equal to or superior than DEET. So although they may prevent mosquito bites to some extent, they don't do so as effectively as DEET containing products. So that's why I said, I know it's not the safest chemical out there on the market, but it is going to be the most effective at preventing mosquito bites. And that is what I would recommend for a transplant recipient who may be exposed to mosquitoes.
Thank you. Sharon asked, what about guinea pigs or hedgehogs?
So they also are similar to things like cats and dogs. So the infections that cats and dogs can carry, Campylobacter, Salmonella, those are also potential risks with guinea pigs and hedgehogs. Just keep in mind that you just have to maintain good pet health regardless of the pet in order to prevent or minimize your chance of infectious agents being transmitted to you.
And thank you. Lauren says that about having cats and kittens, but she's careful. Her family cleans the boxes, etc. And she's had no issues. Guinea pigs are okay. I have 3 in a cage. You can see them behind me on the screen. I've read articles saying hedgehogs aren't safe. What level of gloves should you be wearing? Gardening gloves, medical gloves, when you're doing some of these activities, etc.?
Yeah, so when it comes to gardening or carpentry, then you should be using gloves specific for those activities. All other activities you can just be using like the medical type, gloves or disposable rubber gloves.
Thank you. Is there a level of immunity you try to maintain in your kidney patients, or does it vary from patient to patient? And if so, why? How is one's level of immunity measured?
So it does vary from patient to patient, and that depends on so everyone has for example, if you are a kidney transplant recipient and you are taking tacrolimus, there is a specific goal of tacro range that you should be in when they check your blood work. Some people we have to aim a little bit higher, and some people we have to aim a little bit lower because you are balancing toxicity with the effect of the medication. And that can be different for each person. So how do we measure one's level of immunity? So that's often measured by the infections that they actually get. So again, going back to kidney transplant recipients, there is a particular infection that can involve the kidney itself called BK virus. And BK virus, if you have it, the treatment for it is to back off on your immune suppression and allow your own immune system to kind of tackle that virus. So, but when we see that someone has BK virus, we know that they are overly immune suppressed. Same thing with someone who gets CMV. If they acquire CMV or their own CMV wakes up and becomes a problem, we know that they are overly immune suppressed. So oftentimes that's how we measure it. And other times we measure it based on how far out you are from transplant and if you've had any episodes of rejection since transplantation. So if you've had episodes of rejection, we know that you are likely more immune suppressed than someone who may be the same number of months out from transplant without any episodes of rejection. So it's kind of, there's no great blood test to tell us how immune suppressed someone is. It's really more of a clinical judgment that we use to determine how immune suppressed someone is.
Thank you. Kelly commented that most brie and feta sold in the big supermarkets. It does say it's pasteurized. Mary says goodbye to sushi. Is it safe, Julian, I'm sorry if I'm saying your name wrong. Is it safe to use the CBD drugs that are now on the market for pain, etc.?
So CBD containing products are not FDA regulated. And so we do not know if they contain THC, which is the component of marijuana that causes the high that you get from marijuana. So some of these CBD products can still contain THC, and therefore it may not be the safest for you, but it's also, I understand it is also a way that a lot of people want to combat things like pain or muscle aches and whatnot. And so I wouldn't say don't use them, just make sure that you're getting them from a reputable seller, and try and make sure that the labeling says that it contains no THC. Granted, even if it says that, since it's not an FDA regulated product, it may still contain the THC. So I would say just be cautious, but it is likely safe, but I can't say that with 100% certainty because it's not a regulated product.
I'm going to ask Dan Hughes I'm going to ask him to unmute himself. He has patiently had his hand held up this whole time, so I'm going to ask Dan to go ahead and ask his question. Did I catch you off guard, baby Dan? There we
Yes,
go.
I'm Dan Hughes' wife. We have questions regarding bean sprouts and spring onions. We were told by dietitians that under no circumstances is it to eat it. Now, how about if they are fully cooked?
So even if they're fully cooked, I would say avoid sprouts in particular. The green onions, I think you could potentially cook and be a little bit safer with, but even that may be a risk. But I would say avoiding sprouts is the better way to go, cooked or not.
Another one is about Evusheld and the 4th shots. My husband had 3 shots and of course, no immune response whatsoever. He had Evusheld a month ago. Should he get the 4th shot?
So there's no good data telling us how much antibody response transplant recipients get with a 4th dose and beyond. So I think if he's had minimal response to the first 3 shots, it is possible that he will also have minimal response to the 4th shot. But I would still say it's potentially required, or not required, but would be beneficial to some extent if he does mount any even small amount of antibody production to that 4th shot. It would be good. It would be better than not having any antibody response. But that is a risk that he may not have an antibody response. But the downside of actually being vaccinated is so minimal that it's probably better to, I mean, I would talk to your transplant provider, but in my opinion, it would probably be better to try the 4th shot and see what happens. But definitely talk with your transplant provider, as there may be nuances to your care that would be specific and different than other people.
Thank you very much.
What is it about grapefruit that is a contradiction to eating it with one on immunosuppressants? If we're not on mycophenolate, is grapefruit okay, or is it not okay?
So it's generally grapefruit is not okay, and that's because it activates an enzyme in our body called CYP34A, and that enzyme is responsible for metabolizing drugs. And so you can either increase the metabolism of a drug and clear that drug from your system faster, or you can decrease the metabolism of the drug and it lingers longer, and therefore you are at more risk for toxicity to that drug. So things like mycophenolate and tacrolimus can be affected by grapefruit. So it's important that you don't eat grapefruit. And a lot of transplant recipients end up requiring drugs like Coumadin for other reasons. And Coumadin is also notoriously affected by grapefruit. So I would say, when in doubt, avoid grapefruit.
Thank you. What is wrong with smoked fish? Although I think someone did answer it, but what is wrong with smoked fish?
So smoked fish is not specifically cooked. It may be smoked, but the temperatures achieved are not high enough to kill all the bacteria and viruses and parasites that may be present. And so that's why we say avoid smoked fish.
And can you say a little bit more about avoiding cold cuts? Are we talking about commonly packaged cold cuts that you get from the grocery store?
So the packaged ones in the refrigerated section that are like factory packaged and whatnot are probably a little bit safer than ones that you get at the deli counter, because the ones at the deli counter have been sitting out. Granted, their cases may be temperature controlled. They're still sitting out and potentially acquiring bacteria and parasites on them as they sit out for prolonged periods of time. So it's important that you avoid particularly the ones from the deli counter, but the ones that are factory sealed are probably a little bit safer, but even that we generally advise to avoid if possible.
Wow. Thoughts on to help someone who teaches elementary school students?
So definitely wear a mask. Elementary and younger children tend to be riddled with germs. I tend to call them petri dishes because they are so germy. They are less likely to know how to practice good hand hygiene, less likely to know how to practice good cough and sneezing etiquette, such as coughing into your elbow, things of that nature. So as a result, you're at higher risk for acquiring, in particular, respiratory infections, but also if they have a diarrheal illness, you're also at higher risk of acquiring that because they may not be washing their hands as well after they use the bathroom, or at all after they use the bathroom, depending on how well they've been taught. So it's important that you avoid like exposure to them by wearing a mask. And if you do end up touching hands, or they touch your face or something, better to just wash your hands right afterwards to avoid trying to contract anything else. Because if you wash your hands, if you don't wash your hands after, let's say, shaking their hand, and then you go to touch your eye because you have an itchy eye, you can transmit infections through your eye into your body. And so it's really important that you just practice good hand hygiene and wear a mask whenever possible, at all times, ideally.
Thank you. How have transplant recipients done on molnupiravir if they have gotten COVID-19?
So that's a good question. So transplant recipients, it has not been used significantly to have data out there to tell us exactly what the outcomes have been in transplant recipients who have gotten molnupiravir, but I can say that there's some hesitancy in the transplant community to use it because part of the drug is one that can interact with tacrolimus, and so it requires very close monitoring of your tacrolimus levels. And so it is something that can be done and is being done, but under very close monitoring. But as a result, because it's not being used widespread, we don't have good data yet on saying how they do once they get the drug.
Thank you. Can you still stay on? There's still some questions, Doctor.
Yes.
Thank you.
Mm-hmm.
What is the thought on the fourth dose after Evishield injections?
So getting Evishield injections, I would probably wait a little bit on getting the fourth dose. I would talk to your transplant team, as it may be very specific to you, but generally I would probably wait at least a few months after getting the Evishield before getting a fourth dose.
Thank you. Kelly commented that after her fourth shot, she had lab work to test for antibodies. They were greater than 2,500, which she says are as many antibodies as a non-immunosuppressed person. Is
Yes.
that something you've encountered? Because most transplant recipients we've run into, their antibodies have still been low.
That's correct. That's more of an unusual circumstance in her case, but it's good that it happened. But it's certainly not the norm when it comes to transplant recipients.
Thank you. What is known at this point about Evishield and its impact on transplant recipients and antibody production?
So not much is known. That is the answer to that question. I wish I could give you more information, but unfortunately we don't know that much on its impact on antibody production. We're still unfolding that information and unwrapping it. So if I get an answer in the next couple of months, I will email Michelle and Marty and let them know, and maybe they can disseminate that information. But unfortunately, I don't have an answer to that just yet.
Thank you. Should the household members of transplant recipients be receiving a fourth dose, a fourth booster then?
So at this point in time, it is not recommended that people who are not immunosuppressed get a fourth dose. That may come down the pipeline at some point, but at this point in time, it is not necessarily recommended. It is recommended that they get their third booster dose and then call it a day for the time being. But again, additional boosters for non-immunocompromised people are likely coming down the pipeline. It's just a matter of when that information becomes available and when that may happen.
Thank you. You mentioned living donors needing vaccine. What if donor was a donor 7 years ago?
Oh, so living donors, when I was talking about that, I was referring to living donors who are donating in the COVID era. So that's specific to having been COVID vaccinated. If you donated 7 years ago, that's you were probably fine and probably up to date on all the vaccines that were required at that particular time and had safely donated at that time. If an additional donation is going to be done at some point in the future going forward, then being COVID vaccinated would be beneficial.
Thank you. Is there a waiting period after a Belitacept infusion?
Yeah, so Belitacept is an interesting drug. I would say you should wait at least 3 months after a Belitacept infusion to get vaccinated. But you may also be getting other drugs in addition to Belitacept that may lengthen that time to more like 6 months. So it's really important to, again, talk to your particular transplant provider and discuss your particular case. But generally, waiting approximately 3 months is probably the best way to go.
Thank you. How about contact with people traveling from different countries like UK to India, also children less than 5 years?
So people traveling abroad, you should be sure that you should avoid seeing them immediately after they return. I would probably give them a 2-week quarantine period in your own mind before you engage with them personally, because they can carry infections, not just COVID, but other infections as well if they travel abroad, particularly to places like India, where their sanitary measures are just not the same as the ones we take here or in the UK. The UK is probably a little bit safer, but when it comes to COVID, I would say give them a 2-week quarantine period in your mind. Don't see them until after that 2-week period. When it comes to children less than 5 years, if you are referring to grandchildren, it is a risk. I know I would never say don't see your grandchildren, but I would say if you are going to see your grandchildren and they're less than 5 years, or any children that are less than 5 years, I would recommend wearing a mask and practicing really good hand hygiene and trying as best as possible to maintain some distance. I know it's very difficult to tell a 3 or 4-year-old to not give you a hug or a kiss or to come near you, but try your best. And if there isn't a close interaction, that's okay. Just make sure you're wearing a mask and practice good hand hygiene immediately after the interaction and avoid touching your face if possible. And that's all you can really do. I don't think it's practical or realistic to tell someone to avoid seeing children until a vaccine becomes available for them. So I think it's just important that you use your common sense and you use the knowledge you know about COVID and how it's transmitted to protect yourself.
Thank you. Opinion, please, about cruises for transplant recipients, irrespective of the pandemic.
So I would say, irrespective of the pandemic, cruises can be a risk for norovirus in particular. And I've seen very severe norovirus cases in transplant recipients, even people who are 5-10 years out from transplant and not have had any intensified immune suppression for rejection in the recent years, go on a cruise, get norovirus, and then have norovirus chronically, which is not a pleasant illness to have, and there's no good treatment for it. So it's really just something you end up having to live with. So I would not recommend cruises for transplant recipients outside of the pandemic for the norovirus risks.
Thank you. You mentioned about swimming pools. How safe are swimming pools for kidney transplant patients?
So you can go in swimming pools. I would just avoid drinking the swimming pool water, inadvertently ingesting it. And I would also avoid, if possible, using public swimming pools where there's children who can eliminate like urine and sometimes feces into the pool. And that just places you at a greater risk for infection. So if you are going to go in a pool, it's okay to use a pool, but try to avoid public pools, even things like at places like hotels, and just try to stick to private pools or pools at friends' houses where you know that the people may not be necessarily urinating or defecating into the pool water.
Thank you. Potential infections from a Cpap machine?
So the major infection from a Cpap machine is if you're not cleaning it regularly or as advised to clean it. There can be different mold infections that can arise from your Cpap machine if it's not cleaned regularly or as you've been directed to clean it. So, and those mold infections you can then inhale and develop a mold infection in your lungs in particular. So it's very important that you just maintain good cleaning regimen of your Cpap machine.
Thank you. Any chance that the immune response from COVID-19 vaccine and booster may cause increased rejection chances or increased issues for potential undiagnosed autoimmune diseases in transplant patients?
So, no. All the data so far has indicated that there is no increased chance of rejection, nor is there any increased potential for an undiagnosed autoimmune disease or even flaring of a known autoimmune disease in a transplant recipient. So it is very safe from an immunologic perspective in that way. So there's no risk for rejection or minimal risk. I should say there's been no evidence of rejection in any of the studies done on transplant recipients thus far. And same with autoimmune disorders. So I think it's pretty safe from that standpoint.
Thank you. Maureen wants to know, is air travel safe if you're taking all the precautions, N95, et cetera? She's trying to balance being safe versus a quality of life.
I can understand trying to balance that. That is the challenging balance in this situation. So I would say air travel, the most dangerous part about air travel is the airport, where people are taking off their masks, eating foods, they're in closed quarters, and they are closer together. The seats have not been spaced out necessarily at airports. So you're at risk when you're at the airport. So if you wear an N95 the entire time at the airport and continuously practice good hand hygiene while you're at the airport, and if you take those same measures onto the plane, which the plane is actually a little bit safer than the airport because it has greater air circulation than an airport does. So the plane itself is better, but I would still advise trying to avoid taking off your mask to eat or drink while on that plane. So if you take those measures, air travel can be relatively safe, but it's still one of those things that I would really weigh the risks and benefits and really determine if the benefits of where you're traveling to outweigh the risks of potentially being exposed to COVID or other respiratory illnesses for that matter.
Doc, the one thing that most of us will have on our mind is this year we have our Transplant Games of America happening, and it's going to be in San Diego at the end of July. So I'm sure there's a lot of us on the screen today that are concerned about should we even go or not. So thank you for your answer about the air travel.
We need like a bubble that we just kind of wrap around our whole body. It just kind of.
I know. I really wish we had something like that.
Rent a bus.
So Lisa's 5 months post-transplant, is EvuShield safe to get?
So EvuShield should be safe to get, but not knowing the specifics about the medicines that you're receiving and the type of transplant you've gotten, I would highly recommend you discuss with your transplant team before getting EvuShield. But generally, just based on that question, I would say it is safe to get.
Is it safe to hike in forest areas?
Yes, but be sure to wear good protective shoes and long sleeves and long pants, regardless of the temperature. I know it's uncomfortable if you're doing it in the middle of summer, but it is safe to do as long as you take those protections. And keep in mind, mosquitoes are still in the forest, so you should wear bug repellent or DEET to try and prevent bug bites.
And then of course, oh, can you still hear me? Okay.
Yes.
And then of course, be sure to, if you check yourself for ticks after hiking in the forest, make sure you have not gotten any tick bites. And if you have, seek medical attention.
Mary recommends substituting celery for bean sprouts in Chinese recipes. You still get the crunch without the risk from the sprouts. You can use water chestnuts. Thank you. People talking about great information. What's the difference between spring onion and green onion? Can I eat raw green onions?
So spring onions and green onions are very similar. And I would say they're essentially the same vegetable, but I would not eat raw green onions for the same reasons you shouldn't eat sprouts, because there's a good chance of bacterial infection with it.
I'm going to try and wrap this up. Still a couple more things about EvuShield. People wondering what that is, and I don't know if you can just do a quick overview of that.
Sure. So EvuShield is a form of antibody protection that you can get. It's frequently being used in the form of prophylaxis. So if you've been exposed, getting it, or in the more common scenario is before you've been exposed, getting EvuShield to try and protect you from that exposure if you were to get exposed. So it is something that is starting to become more commonly used at transplant centers. But it is one of those things that you should discuss with your transplant team, because depending on the medicines you're getting, there may or may not be benefit to getting EvuShield. And it may be worthwhile to just really investigate that with your transplant team.
And we still have a couple of people that are upset about the deli meat topic, and because they still want to eat. It is convenient and it is tasty. And Donna said that her dietitian said to heat to steaming the deli meat just prior to eating. Do you think that's something that's beneficial?
So if you can heat the deli meat to appropriate cooking temperatures, it may be safer to eat, because you may then be killing the bacteria that may have been present on the meat. But it's not foolproof. So it may be safer, but I can't say that with 100%. So it's really important that trying to avoid deli meat, as I know as difficult as that is, I would recommend avoiding it if possible. But if you must have it, that may be the better way to go. But again, it's not going to be 100% foolproof, and there is still risk for infection.
2 more things and I'm done.
Sure.
How long should isolation be maintained by caregivers or spouses following transplant patient surgery?
I'm sorry, can you repeat that?
Yes. How long should isolation be maintained by the spouse following transplant patient surgery? So their husband just got transplanted. How long should the spouse be in isolation during this COVID time?
Yeah. So if someone's been just transplanted and their spouse, I'm assuming this question is referring to if the spouse gets COVID or has been exposed to COVID.
It didn't specify that, but I just think they're saying their spouse got transplanted, and because COVID's going around, should they be isolated maybe and not be around their husband for a period of time following the transplant? That's how I took the question. I might be incorrect.
Okay. Well, I think in that instance, I don't think that isolation should necessarily be something that you have to perform after a transplant if your spouse got transplanted. I think if you wear a mask and practice good hand hygiene and also prevent yourself from being exposed to different things, so avoiding high risk situations for yourself, that should be okay. But it is a risk. Nothing is 100% safe, unfortunately. So I would say, just take the measures that you can take to prevent infection from entering your household. And that is the best you can do. I don't think it's necessary to avoid your husband for 2 weeks or something like that after his transplant or anything like that.
Okay, I lied. 2 more things. Lauren said the deli meat guy in her store does not wear his mask now, and it really freaks her out. So I thought that was funny. And then Mary said, thank you to us, but a big thanks to you, Dr. Seema, because this was really a helpful session. And she wished she had this recording when she had her transplant 5 years ago.
Aww.
So everyone really appreciated all your information. There's more than a dozen thank yous and great information. And Charles, I think, said it was the best presentation ever, and great presentation. Thank you very much. So everyone's sending you hugs and kisses, and thank you. It's very helpful. Everyone's giving you the thumbs up here on the screen. So thank you so much for staying all this extra time. We appreciate it, but everyone does have a lot of questions and everyone's trying to stay safe. So we appreciate your time.
I was going to say, I personally want to thank you too. Along with, I want to thank everyone that got on the call today, all our members and guests. We love seeing all of you. Let me remind you about our website, triomaryland.org. That's www.triomaryland.org. Why that's important is if you go in there on our front page, you can also find the access to YouTube, where you will find a recording of our conference sessions and all of our meetings that we have had over the last 2 years, including today's. Today's should be posted within the next week. And please don't forget to check out our Facebook and Twitter. Like us on Facebook if you can. And we wish you all a safe and healthy weekend and a happy Valentine's Day, especially you, Dr. Seema. Thank you.
Thank you. Thank you for having me. And just keep in mind that my email is on the last slide of the talk. So if questions arise afterwards, or if someone's going through this after the fact and they have a question that comes up, please feel free to email me and I'm happy to do my best to answer it.
Dr. Seema will be sending us her presentation, and that also will be on our website that you can access under events. So anything you missed or you didn't get a picture of a screen you wanted, you'll be able to see that in a few days on our website and get the information you need. Okay. Thank you.
Thank you.
Thank you, everybody.
Stay warm
Thank
in Colorado.
Thank you, Dr. Seema.
You're welcome.
Thank you
See
so
you,
much. This was
Michelle.
wonderful.
Marty.
Bye-bye.
Bye, guys.
Bye, Dario.
Bye.
Happy Valentine's Day, everyone.